Okay, starting over.
There we go. Autonomic nervous system and those processes that might change when you get nervous, when you exercise, all the heart rate variability, blood pressure, breathing patterns, strength, and then muscle activity. So this system is kind of nice because it's set up both for research and for teaching. So what classes have you taken so far?
Blind nutrition.
Okay.
So they have 2 years ago.
Okay, so you haven't taken an XPhys yet or exercise prescription at all? Okay, perfect. So if you take XPhys, you might see this again. Dr. Haig uses it a lot. So what we're going to do is just show a little bit of its capabilities, and it's available for you to play around with too whenever you want to. So Professor Myers has access to it. So the first thing that we will do is basically look at an ECG. So do you know what an ECG is? Nope. I'm gonna have Denise or Jen explain the ECG to you.
I know what the ECG is. Well, it's reading your heart rate and rhythm and getting everything like charted, I guess, so to speak, so that we can take a look to see if there's any health concerns and or need to be talking a little bit closer and or things that might come up when it comes to putting together a training plan or just evaluating fitness level.
Savannah, do you use ECG at all at your you're at a nursing home, correct?
Correct. I currently don't use anything with
Okay.
that, any sort of monitors. We do heart rate once in a while for some heart rate target stuff, but no.
Okay, perfect. Hey, how are you? Good. Okay, so for ECG on this system, we are just going to use 3 sensors. You can use all the way up to 12 leads. They call it 12 lead ECG. That would be a lot more sites in the body to kind of get those signals from. So today we are just going to do 3 leads. So you have 2 that are going to be on your wrist, and then 1 is going to be on the abdomen, kind of down about hip height. The other thing that we are going to do with the ECG is also measure your heart rate. So we will be measuring heart rate either on the pad of your middle finger, or you could do the pad of the thumb, whichever one you are most comfortable with. Other times, this software will want you to put the heart rate on your elbow too. So 2 different locations. I should not have put the Velcro on my sweater. My nice new sweater. This is why I don't own sweaters. So pretty simple, pretty easy. So what we are going to do today is really just look at a resting heart rate and ECG. So who wants to be my subject?
Ro will do it.
Okay, sounds good. So we will have you come sit right here. Jen, can you help with the camera, kind of making sure that we can see the screen?
Yeah.
And everything. So it's following me right now. And I will hand it off to you. So
follow me,
with
yo.
ECG, we will need you to take your watch off. So for this ECG and pretty much any ECG, they want any jewelry to come off the skin, just because it can mess with those electrical signals. So I'm going to just clean your wrist. Perfect. And you don't have any adhesive allergies, right? Okay. I will warn you, I don't have adhesive allergies, but I came home with a big red spot from these. So you see that, it's completely normal.
Okay.
So we're just using,
Now come back over here.
we're using disposable sensors. So
I can't remember what's my other hand thing to stop following me.
you just do that again. So these have some gel on the inside to kind of connect that sensor to the skin. And it allows for the electrical signal to have better conductance coming out of the skin onto the sensors. And then I'm gonna have you stand up and you're gonna clean off a spot right on your headphones.
This is turn blue. Sorry, guys, this is so non-professional.
Perfect. You can sense that where you. I don't want you to follow me.
Good.
Yep, that's good. So the nice thing about this software is it will tell you where to do everything. So we got the sensors placed. You just want to make sure I put the right sensors in the right area. So the red one goes to your left wrist. And then the black one goes to the right. And then I'm going to have you stick this one to the sensor on your abdomen. Perfect. Okay, and you can sit back down. Okay, so all we are going to have you do while we're getting this is really just sit there, feet flat on the ground. Professor Myers, why wouldn't we want our feet crossed?
We don't want our blood pressure artificially elevated or anything pinch or tighten.
Feel good? Okay, so you can relax, hands on your lap. So I will push start on the screen. We used to have this big screen, it doesn't work right now. So I am just going to start it and make sure we have good signals here.
Doesn't hurt, right?
I just feel a heartbeat in my thumb.
Yeah.
Uh-huh.
It's funny how that makes. But it's not right. So this is not how it's supposed to look. So this is good to show. I'm guessing that it is not looking right because we plugged in the sensors after we had everything turned on.
Oh, yeah, sure.
So this is a good thing to notice that, yeah, we probably need to restart. So I will take everything off. Restart and see if that's going to change it. Okay. Doesn't look right. This was not how it looked yesterday. Huh? That is not a normal rhythm. That is not how it's supposed to look.
Sorry, you're good. Not
Try this again.
Just a little whack heartbeat.
good.
Okay, let's try it again. They took away some of my things, so let's see if it looks better. There we go. Beautiful. So I don't know why they have more sensors than we did. So you can see that his beats per minute is down on the lower half here, and then this is his heart rhythm. So what I'm going to ask you to do is kind of move your arms. I want to see what happens. So you can see how movement would influence this system, right? So that is catching the movement and not catching the actual heart rate. So what we would have to do if you were moving, we would actually have to go in and filter out all that movement, which is a whole ordeal. If we were to have you exercise and come back, do you guys know what would change?
Exercising and then coming back and then sitting down in a resting position.
Yeah.
Well, heart rate would be higher with the exercising, and then we would hopefully see it drop. And what is our top measuring volume? No,
That's your just
the timing, the cadence.
Yep.
Yeah, so our cadence would be way squeezed together.
Yeah, so you would see more closely related spiking. Any questions on ECG? So this is nice because it can be, you're trying to see it move again. This can be used for so many different types of studies, and I'm kind of bummed that Dr. Ostrom isn't here today because he's the ECG guy. He would know all about 12 leads, 6 leads, what we can do with 3 leads. This is not my area. I'm a biomechanist, so I can do some things, but not this one. Any questions on ECGs? I'll get this one off you. If you want to unplug the sensors. Then the next thing we're gonna do you mind being the subject for another one? Is we will, and I am gonna have Denise or Jen or Denise be the one with this, the shocking.
Oh, yeah.
Unless the students want to do this, but we are going to set him up to measure, and I know I say measure weird, everyone tells me that. It's measure and not measure. This one's going to stay, but you can take this one and the one on your abdomen off. Okay, so what we are going to do now is we are going to evaluate EMG and muscle strength. So do you guys know what EMG is? No. So your muscles, similar to your heart, have electricity. That's how they activate, that's how we can read them. So EMG is basically measuring your electrical currents that are being activated in your muscles. So we can do surface EMG, you can do internal EMG. What this is getting us here is basically going to be a conglomerate of all the muscle activity happening in your forearm. The biggest issue with EMG on the surface is we can't get a single muscle because it does take everything that's going around. We can do needle and fine wire EMGs. You have to be a doctor to do those and be certified. So we can't do those here, but those are really important for, say, clinical cases. So we do that for children with CP who need to actually see those deeper muscles and more specific muscles. So now we are going to set you up for the EMG. So can you roll your sleeve up to kind of your elbow? For this one, we are going to do grip strength. So we are going to basically see how much muscle activity is here. So he's going to have 3 sensors set up. One, I don't know, like radial side for this one. And then we'll put one more on the ulnar side right here.
Or who should know all his anatomy.
Does
Anyone
anyone
from students, so.
know why I clean with alcohol before I put the sensors on?
Better connection.
Conductivity.
Yeah, better connection. So if you come in with skin oil or lotion, you're not going to be able to get that connection and you'll get more noise.
Interference.
So that is a common thing you'll hear with biomechanics people. We like to talk about noise. Noise can be good, but noise is always in the system. So we want to try to filter out noise. Okay, so we got his EMG set up. And now we're going to just connect our muscle strength sensor. So we're doing hand grip strength. So we've got this little device. It's got a little hand squeezy, and then it is going to be measuring pounds per square inch, so PSI. So hold that in that hand. So what I'm going to have you do is you're going to sit and relax. You can rest your arm on your leg, sit and relax for 10 seconds. And then we're going to do 5 squeezes of the muscle sensor. And I want each squeeze to get harder in strength. So the first one's going to be very light, second, third, till max strength from the 5th way.
Okay.
The key is to try to squeeze it for the same amount of time. So maybe when you're squeezing, count 1, 2, 3, and then let go. And then I'll tell you when to squeeze again. Okay? Okay, so on this screen, EMG is going to be up top, muscle force will be on the bottom. The thing to note about the muscle force, there will be an offset on this screen because I did not calibrate it, and every muscle force sensor has this sort of offset. Think of it as a scale. You calibrate the scale to be 0 before you hop on it. So you can see here our sensor has about an offset of 14. And we are going to auto scale this top one. So you can see that is his resting muscle activity. You can see that it's noisy still. If we were to have the elevator go off, we would see lots of noise in that because the electricity in the room is going to influence your EMG. The lights are on a 50 hertz frequency, and those also influence things. So I am going to make sure everything's auto scaled. You can see you gripped it a little, right? Okay, we are going to have you start this first light grip.
Okay.
Yep, go. Perfect, and relax. And then a little bit harder. Perfect, relax. And scale these out. And go again, harder than the last one. Good. That was 3. Let's do a 4th one, harder. And then we'll do one final one as hard as you can. Go. Perfect, and relax. Awesome, you can relax. So you can see how they kind of scale together. This is the hardest one. It goes up to about a 30 PSI here. You can see he has his baseline muscle activity there. If we scroll over, hopefully I can get them both in. You can see that he is at a 28 PSI and it's not quite as large of a magnitude. EMG is a little wonky to read because we actually cut it in half and flip the bottom half up to the top because it's almost a mirror image. So when we are analyzing, we'll do that. A lot of people for EMG are just interested in when it's activated. So she said you're OMP.
Yeah.
You would be pretty interested in when the muscles would be activated, more than what frequency they're activated or how much activated. So you will see EMG used in gait analyses to kind of see if the muscles are firing at the right point in time and how much they're firing. So when we have the push-off phase of gait, we want to make sure that the right muscle is doing that push-off phase. And if not, maybe we can do. Any questions about EMG and what we're seeing on the screen here? You can see that the force and the muscle activity somewhat reflect each other.
I'm also wondering if you could use this, not maybe predictively, but perhaps someone who is doing weightlifting or a sport and maybe 100% grip strength isn't the goal, right? Like, how do you teach somebody like this is what 80% should look like, or 70% should look like and feel like, and then how they could look at that biofeedback and then
I know
duplicate that.
Baseball, they were using my torque sensors to actually track workload. And so they would do a max workload, get that max workload of torque on their arm when they're throwing, and then they would calculate what their workload was supposed to be. So yeah, this would be a great idea to kind of train muscle activity and intensity levels.
Right.
So any other questions here? I was telling Denise and Jen earlier, EMG is hard to do in research because we can't do a pre-post test on EMG because we very rarely can put the sensors back in the exact same spot. So then your signal is going to depend on that actual location more than anything. Perfect. So we will get this off. I'll take these, but I'm going to trust that you can get the sensors off.
You want all of them off?
Yeah, you can take all of them off. I'm gonna make someone else be the guinea pig now. So next, I think we're going to do some breathing. Do you want to do some breathing?
Sure.
It's pretty simple. And then we'll make one of the professors be the guinea pig for the shot. So, the breathing is important, right? For many things. When would your breath rate go up? Any ideas? When would you start breathing heavier?
You're nervous.
Yeah, when you're nervous, or are you gonna be breathing really fast? Exercise, yep. Exercise, breathing. So if we were going to look at lung capacity, what kind of things could we do to look at lung?
We need to look at like how to measure it or why.
Well, how to measure the changes that would occur. So if I
Right.
give you a sensor, what would I do?
Oh, yeah. We'd have to go in our mouth. 'Cause that's where we're
So what do you think this is?
exhaling.
This is the sensor, right? So this actually gets stuck in your mouth and you breathe in and out. And if you look, there's kind of a barrier in there that is stopping your breath from going all the way through. And that pushes the air up through the tubing, so then we can actually see what's going on. So if you do VO2 max testing, they will actually have fancier versions of this. And they'll plug your nose and put a mask over, and yeah, I'm not gonna make you do that. Technically for this, I should have a nose clip too, to kind of block your nose from offering up air, right? If we wanna look at lung capacity, we only want it coming from one direction. So just hold on to that for me. You don't have to start. I'm gonna clean it really quick too.
Okay.
Professor Myers, did we clean it after you did?
I did, correct.
Oh, you did.
I did.
So you cleaned it, but it's been sitting on this mat. Do you want it cleaned again?
I mean, sure.
Okay. That's the right answer.
Mm-hmm. I can go get a nose plug from next door too.
You can breathe out your mouth and not your nose, right? If you don't, I'm gonna make you hold it.
Yeah, I can probably do it.
Perfect. So when we are doing this, you're going to want to hold the sensor so that the tubing comes up. We don't want the tubing to go down because then we would get saliva in the tubing. And we don't want saliva in the tubing. So when you are doing it, you're going to want to hold it that way. And you a little bit more. So what we are going to do is you are going to breathe normally for like 4 or 5 breaths. And then you're going to take one really big inhale and exhale. We're going to see what it looks like on the screen. Okay. So when I tell you put it in your mouth, right now you're good. Don't worry about putting it in your mouth quite yet. It's gonna feel really weird too. And Denise, can you come hold the tubing for him so that if he wants to hold his nose, he can. So I'm gonna start it and make sure everything looks good. Perfect. So go ahead and put it in your mouth and start breathing like normal. Lips all the way around. Yep. Perfect. Keep breathing like normal. Good. Perfect. Now do that one big inhale and exhale. Perfect. And resume breathing for like 3 breaths. And relax. Okay. Perfect. Take it out. How'd that feel?
It felt a little.
Weird, right? We don't ever really think about breathing out our mouth until we're exercising or we're sick. So yeah. So you can see here on the bottom, this is your breathing. The downwards are your breathing in, upwards are breathing out. So if we scroll backwards, you can see you went off the page. That is going to be when you did that giant breath, right? So what was interesting here was you did your normal breathing, looks pretty normal. And then you took this big inhale, a big exhale, and then it readjusted up there and kept it up there.
Weird.
I can't tell you why, but that is the spike where you exhaled, and you can see you were exhaling for quite a long time, right? And then it leveled out again, and you got back into your normal rhythm. Yeah, so any ideas, seeing that graph, what you could do with that now? How would it change if we put you exercising? What would happen to this curve here? More rapid. Do you think it would be higher, like a higher slope, or would it be less of a peak and more shallow?
It depends on your conditioning level, right? Perhaps, so if you're going from aerobic to anaerobic, that breathing mechanism might, you would shrink, the breathing would be more rapid and the
Yeah.
dips would be
So,
big.
so these would be closer together because this is time on the bottom. It would be closer, but would it be higher in terms of the leader taking in, or would you be shallower and not taking in as much air at one time? Keep going.
Keep going.
Yeah. So there are ones that we could look at the heartbeat and see what's happening with the heartbeat and the breathing. So yeah, definitely we could see that. It could be dependent on the person too. If you were looking at an individual with asthma or COPD, it might be that they're breathing faster, but then they also wouldn't have as much of a peak because they couldn't get as much air.
Yeah,
in.
low quality breaths, right?
Those are definitely things that you can use this lung volume evaluation for. Okay. Last thing is reaction time and conditioning. And which
I'm happy to do
professor?
it. Unless you guys want to do it, it's a little electric shock. Yeah, do it again.
Okay.
Students give it a try.
He's tough. So for this, we are going to do reaction time condition. So what we are going to do is you're going to have a
Oh, I was going on the back end, that's why I was like, just kidding.
yeah, how you learn. We are going to have 2 stimulation sensors. They are going to stimulate basically, I think it's your median nerve. I have to look at this up. And it's just going to be a little shock. And what we're going to do is if you take too long to react to a green light, it's going to give you a shock. And we're going to see if you get faster as you learn.
Are you colorblind? Okay, good. Cause that could be bad.
That could be bad. That's one thing that we typically have to write about in research is if someone's colorblind. So I'm actually surprised they did green and red as their triggers here,
Right.
because you usually avoid green and red in research.
Although maybe they're thinking psychologically green means go, right? And if they're trying to tie in a.
Yeah, we do have red light, green light on. So yeah, we do have that. It's under the human nerve, and it is the conditioned response. So, Jen, do you want to set him up?
Sure. Looks like we need.
Okay, so we need
This bad boy.
No,
just kidding.
because-
This bad boy.
yeah, that one. And Jen, what did you have to learn about that bad boy when you first set up earlier?
That it hooks up to the back.
Yes, up to the back, yep.
one,
Yeah,
and this will be your dominant hand.
okay, and then for this one, we're only using 2 sensors. And it is not the median nerve because it's on the outside of your hand, but you'll put one smack dab in the center of this non-dominant hand, and then you'll put one on the outside. So he does need these.
And this does not need to be calibrated before.
Nope. No.
This is like an awesome video game console, right?
Get all.
I know, like exactly.
Old one.
And of course, you signed a release and liability waiver, so.
We have those.
You're a student here, so you're,
We have official ones for the lab too. Okay. I just gotta make sure I know which setting to do it on. I want you to practice it, and we're not gonna analyze because it take a long time. But we will do qualitative feedback and see if you actually feel like you're getting.
so this could be reaction time for sports, right? Could be.
So I've done reaction time studies with kids versus adults because their motor planning is a little delayed. And then we compared them also to kids with cerebral palsy to see how delayed their motor planning is. So reaction time is basically this motor plan. And then it's also how quickly you can process visual cues.
Oh, this goes in this hand?
All right, which
Yeah.
is your,
Yep.
Where's my dominant hand?
So you did it backwards,
Okay.
but no, it's fine, leave it.
what, I don't remember what I said. I think I had said that in your dominant hand. but
Yeah.
that's
And then
okay.
he was holding it.
Oh, I didn't.
Okay.
I was holding it.
Okay.
I mean, we can
It's
talk.
no, it's totally fine. So we will just see how your non-dominant.
And what Dr. Davies said is why we don't want it in here is because then if you get that shock, right, that's gonna like read into, like there might be some automatic.
So the first round, you are just going to see your
Yeah.
green. And I want you to kind of get used to it. It's gonna be a green screen popping up. Yeah, perfect. The green stays on there quite a while.
Does.
And for those watching, you can see that we get a trigger every time that the green comes up and then he clicks too. And it also tells us when things resume. So. Perfect.
Yeah.
Fantastic.
I just gotta press, I don't have to hold it, right?
Yep, just press and release. So you can see that here's the green. Green triggers first line, and then that would be your button push. So how'd you feel? Pretty good?
You good?
Okay. So now if we give you a shock, do you think you're gonna get fast?
Probably not.
Well, let's see. He might be fast enough, he doesn't ever get.
That's what I was wondering, what the delay is. It's long purpose.
I think you're faster. Do you feel faster?
No. I'm waiting for the shot.
Well,
Yeah,
why don't we go really slow one time? There. So now that you felt it, do you think you're gonna go faster?
Maybe.
I think it's done. So how did you feel?
It shocked me the first time, and I thought I missed it.
Oh.
It was like a sample shot.
Yeah, make sure it's going. So, do you guys think he would go faster with the shock?
Probably.
Definitely. So, this is called conditioned response. What would you think if you could think of anything that you could condition a reaction with a small shock? What would you think about conditioning? I can pick this.
I like the type of situation, yeah.
What type of situation? And you can.
Like my husband getting his butt out the door. We will edit that out of the video.
I mean, you could send a little shock on how many times someone had snooze, right?
Yep,
Yeah.
those kind of behaviors, yep.
What do you think? What can we condition people? Was it an intense shock?
Maybe just reaction time.
Reaction time.
Yeah, reaction time. So maybe put it on the hand or foot for a block start and see if they can get off faster, because they're gonna get a little shock.
How about picking up your cell phone absentmindedly?
Oh, I'd be shocked all day.
So Professor Myers found out that there's one that looks at bodily reactions with cell phone addiction. And for the lab, you have to give up your cell phone for 15 minutes. He's like, that's easy, and us was like, so for the shock, I was telling Professor Myers and Professor Howard earlier that when I was in my PhD, we actually were looking to see if we could do gait training with a shock on the foot. And we set parameters on how big of a foot step we wanted the person to take. And if they made it within that footstep, they didn't get a shock. But if they went outside, so too short or too long, they got a shock. So we were trying to see if we could condition them to have a more normal step length. So that kind of goes into that O&P. If you give them a prosthetic or an AFO, would that potentially be useful to help them rely on that prosthetic? Or maybe it's a toe drop thing and you want them to practice lifting their toe up.
I think now it's more like when they use it for like prosthetics, at least with bionic hands, so that they can like connect the electrodes to like the hand, because the nerves are still technically intact, so they can still move like fingers when they have bionic, which is pretty new technology. I don't think that.
Really cool. Any questions about this? This is here for you guys to play with all the time. So if you learn something about EMG, like the bionic hands, and you want to come just play with EMG, let us know and you guys can play with this. It's available for research, it's available to play with. Any of the professors can get you set up in it. We didn't do skin temperatures, so this can measure skin temperature as well. And there are blood pressure cuffs, but we couldn't figure out how to get them connected, so that means a little bit more time.
And something else I had thought of for sports psychology too, when I had my students with me, is pre-competition anxiety, right? And then people being able to see what their anxiety looks like what is my heart rate doing? How is my breathing? How is my reaction time? And then teaching yourself to be able to modulate some of that.
And what were we talking about with yoga earlier?
Right. So some deeper type of breathing or a more belly breathing, so that you could see on the screen what's actually happening in your body and then be able to replicate that, right? So there's definitely opportunities for it in many different avenues of performance.
Okay.
Thanks, everybody.
Well, thanks, everyone.